Nisha Boschway, who is a dear friend and colleague of mine at the University of Virginia. She's an associate professor in the School of Architecture and Urban Planning. And she's done an incredible amount of work thinking about integrated training programs. And what I've asked her to do today is show you just talk generally about her work in this area, but she's also developed an incredibly useful website, which she'll give you a little tour of, and it's dedicated to the idea of promoting integrated training programs, interdisciplinary training programs. Nisha?
Thank you. I assume that the LCD projector is warming up. Great. So I'll start so we have time for lots of discussion, and you'll be able to see the slides as we go along. I'm just going to go through a few slides, about 8 quick slides, and then we'll give you a quick tour of the website and then end with just 2 or 3 questions. So we know that research in this area of health and place has kind of blown up since probably about 2000. The first article on physical activity was in 1995 that I've been able to find. There are perhaps others, and so based on what you're searching for is what you get. But looking for physical activity, food, and injury related to the built environment, what we see are articles from 1995 with a good group in 2004 where we see a lot of food articles being published in peer-reviewed journals, and then some on injury, pedestrian injury, and the like. And so, but we see the research explosion, but what then follows are practitioners finding this information in our peer-reviewed journals and perhaps in other places, trying to apply the findings. But then we weren't until about 2004 starting to train students in using some of the tools that were available then and more tools that are available now, and how to actually conduct research, how to apply some of these things in the field. And so what I'm going to be talking about is what some of that training actually looks like, who's doing it, and what we might want to be thinking about in extending that training. This is the health impact pyramid that Andy showed you yesterday that Tom Frieden from CDC authored in 2010, and what this is meant to show you is from the ACSP, Association for Collegiate Schools of Planning, tracks that there are a variety of ways that people in planning can begin to think about changing the context, right? So not the individual level education, clinical interventions, but down to the population level, really changing the context in which people live to have an impact on health. And so this is one way that planners, at least from this lens, can think about engaging in health, because we have to make the engagement in health for planners, architects, other designers, landscape architects, to fit the boxes in which we operate, right? And so this is one way that it can fit in the planning box. And so the conversation on training really started around this time in Boston at the APHA meeting. There was a panel that Jason Corburn, Russ Lopez, who's at BU, and myself and one other presented on it, titled Teaching the Built Environment Health Connection. And we realized at that session that there was a significant gap in what was being taught and what students really needed to learn. And so from that meeting, a number of colleagues, Andy Dannenberg in the room, Karen Mumford, Cheryl Content, and others, we authored this paper in the American Journal of Preventative Medicine, a model curriculum for a course on the built environment and public health. And those of you who've published articles know that you have to edit a lot of words out. And there was just a lot of information that we wanted to provide for the public. For faculty as well as students. And so that made its way into the Built Environment and Public Health Curriculum website, bephc.com. And the aim of the course, as well as the website, is to provide understanding of the interactions between built environment and health, and the skills to engage these issues as professional planners, public health practitioners, and other related professionals. And so the focus here is not just having the theory, right, but really having the skills in which to apply what they're learning in the classroom. When I think about the way I approach my teaching is that I want my students to be able to practice in the classroom what they're going to have to do in the field. So yes, we write reports and we do papers, but we don't do a whole lot of midterm exams or multiple choice, right? Because they're not going to have a multiple choice exam out in the field. So they are being assessed in the same ways that they would be assessed in the field. And so this focus on skills really is helping them to practice the skills in a safe space, the classroom, before they actually have to do it in the field. And then the learning goals are based on significant learning, not significant teaching, right? So the focus for our classroom activity is for the students to learn, not for us to teach well, right? The teaching well is part of the process. Learning is the end product. And so in the curriculum, I'm focusing on students, one, understanding content, right? But then identifying what are the most important dimensions of built environment, public health, and so on that they need to know to kind of hook onto. How does this impact themselves, reflecting on their own experiences, and then being able to apply that knowledge to what we're learning in the classroom, adopting new feelings. And so when we go through the vulnerable populations unit, I have students who, for instance, have gone to a senior citizens water aerobics class, and they're saying, oh, we'll go in the water for an hour, it'll be fine. They come back to class the next week sore. And they're saying, man, I didn't realize that, these senior citizens could actually work out as hard as they do, and then they go for bagels afterwards. And so it's more than just the physical activity benefits, but there are also these social capital opportunities, developing the skills that I talked about, and then integrating all of that information in the end. And so here's the website. There are a number of resources on the site. I'm going to walk you through it, but just want to point out that one of the things on the site are assignments that you can download, and I'll just walk you through an assignment that's very fresh. It was just, we're actually in process now. Wednesday we were at an elementary school working with students around these principles of healthy neighborhoods that I'm developing with a few of you who are here in the room through a Delphi method. And I asked the students to vet the principles that we've developed. So we've developed 5 principles. They're still in draft, so I am not presenting them here. But the students are looking at kind of our watered down sheet of the 5 principles. We had a discussion and we asked, do these things make sense to you? What does it mean to have access to jobs, food, schools? What's important about that? Safe spaces, access to green space. And some of the things that the students said was, it's important that we have big houses and small houses, a few mansions in the neighborhood, a few teepees. So they get the scale and mixed use piece, even as 3rd and 4th graders. They also said that cul-de-sacs were really important to them, and we heard from, I think it was Bill yesterday, that cul-de-sacs are not as important for walkability to kids, but it is that they are. But connected streets are more important to adults than they are to kids, and so we see that bearing out in this one anecdote. And then, what really struck me was one of the kids, and he's actually the kid in the red sweater, Alex. He said, I love trees, I love to climb trees, but I can't climb them because they cut the limbs up too far. I can't reach them. And perhaps that's a liability issue, right, for Parks and Rec departments, but that's what kids want. And you can see that he's drawing a green field. He was just coloring green for the full 10 or so minutes, and then drew in little stick figures to show his representation of what he wanted his neighborhood, his healthy neighborhood, to look like. And so we have poems from the kids. We have these pictures where they've indicated what they're saying in the picture as well as drawing the picture, and then we've done a mapping exercise, and we'll do a number of analyses on these documents and integrate them in the Principles of Healthy Neighborhoods work we're doing. After that hour-long session with the kids in the classroom, we went out on school buses And we had them do a mini photo voice project where we asked them to take pictures of the dimensions of their neighborhoods that they could see. What is there in the community? What do they understand about the community? What do they like about it? And here are just a few examples. One says front porches to see people. That's important. Crosswalks to places is another important piece. Cities hide stuff in roads. And so the student was able to see this patchwork of the street and say, oh, that's where they put the water and the utilities. And so the kids are beginning to make visible and understanding what's underneath this patchwork, much of the invisible operation of cities. And then gardens, another one, and that's just a small set of tomato plants, I think. And one of the additional products of this, as I was mentioning to James, is a game that we're hoping to develop. As a PhD trained in planning with an MPH, I'm not a game technology kind of gal. I like it, but I don't know how to do it or make them. And so what we have here is really just version 1.0 of a board game, Race to School. And this Race to School game will incorporate a lot of the things that the students have put in their poems that they wrote in explaining their pictures. You start off at the beginning, and if you land on the bus stop location, you have to wait 3 turns, but then you get to advance, kind of like Chutes and Ladders all the way to school, and you're not tardy. If you land on the grocery store block, and I'm not seeing which one that is, you can pick up a fruit or a chips card. And then if you land on the angry dog or on the rain or on the snow barrier, if you have the produce card, then you get to skip over. If you have the chip card, then you have to go all the way back, and then you're late to school. So really helping these elementary school kids think about place within the context of the school environment, their way to school and their way back to school. And so just be the website by the numbers, the Built Environment Public Health Training by the numbers. There are about 280 hits on the website a day, either downloads or visits to the site from all over the world. This ebbs and flows as you go from spring, where students are looking for information on schools that they should be going to, who's doing research in this area, who's researching topics of food and health, and then faculty or who are also interested in downloading resources for teaching. There are 41 planning schools with faculty who have health research interests. Thinking about courses, in 2004 there was one course in a planning program on built environment and health, and that was at UVA. There are other courses that were on physical activity or food, but a comprehensive course, this is what this Built Environment Public Health website and training talks about. In 2007 there were 6, and in 2011 now there are 16 that I've been able to find. There's no voluntary data input or the like for the website at this point, but perhaps that's one of the products that can follow. Certificate or concentration programs from a planning perspective, there are 19 across the country. There are 10 joint degree programs between planning and public health departments, and then there are 4 architecture or landscape architecture courses on health and place. And so this is a new addition. They are at UVA, University of Florida, and University of Chicago. 2 of the 4 I'm counting are bills. And then there is one joint degree program that I've been able to find, and that's at the University of Florida between architecture and public health. So let's take a look at the website. Easy find on Google. And here's the website. So we have the Built Environment Public Health curriculum news, so any interesting conferences that are coming up and the like is found there. As you scroll down, you'll see course design information that you can click on to help guide faculty through how to design a course, sample units, readings, and assignments. This BEPH education focuses on where students might want to study this topic, where the faculty are doing research and so on. And then we have sample syllabi, helpful websites, and BEPH news. Also on the right, there are always these interesting videos, whether it's the music stair video, and there's no audio, but that's fine, whether it's the music stair video or something else. And so there is always a new video that's posted about once a month that then goes back to the previous posts on videos, so you can see what videos are there. They're also organized based on topics. So you can see a number of the videos, but also topics: design, food, pechakuchas that my students have done, planning, and public health. So if we look at course design, you have just a general overview of the background of public health and planning, course outlines, and then learning goals, which I went through with you briefly, but are in full there, and again focuses on understanding and skills. I just want to point you to units. So 4 units, and these units are really based on the 6 courses that were established in 2004 or 2006. And those courses have evolved over time because we have new research. We have great new textbooks, one that Andy has edited, another that Dick Jackson has coming out this month, I believe. But if we look at Unit 2 in particular, going back to health impact assessments, there's just a great resource I want to point you to, and that is once you go through this overview of what the unit includes and what the learning goal is that the students would be focusing on. So here for Unit 2 is application. The topics are listed, but there's also online resources. And the American Planning Association has this Planning for Healthy Places with Health Impact Assessment. That's an online tool that students can go through as a homework assignment. So they're actually doing their reading out of class, and they can apply the lessons during the class time. So highlighting just readings quickly for you so you can see what we have. And one of the speakers, I think it was Jack yesterday, said that it's really important that we not only have the abstract of an article, but can actually go to it online. And so just pointing out, here are some of the required readings that are commonly used in the courses that are taught around the country, as well as additional texts that may be used in specific courses. And then if we look at articles, the articles are all hyperlinked out of there to PDFs or databases that you can access, at your college campus. So the website is updated from readings and so on about once every 2 months, and then the faculty piece and who's teaching what is updated once a year. Just 2 more highlights. One is assignments, and so there's a full list of assignments that includes learning objectives and the assignment description. And then if you scroll over to the right, you have the opportunity to download, so you think you can communicate about healthy communities. And that gives you a PDF, if it opens, of the actual assignment that you can craft for your own classroom, or you can print and hand out as you see fit. It's not opening as quickly as I'd like, so I think I'll jump back and let you explore on your own. And then let's get to what Matt really asked me to talk about, which is the education. And so the education here is broken into tiers. Tier 1 includes the colleges and universities whose faculty have a public health specialization. Tier 2, planning programs that offer a course connecting the built environment and public health. And typically these are cross-listed between a public health program and a planning program, sometimes also architecture, but that's in those 4 cases. Tier 3 are planning programs that offer a course, and then Tier 4, a course, and then the certificate programs. And then Tier 4 are those joint degree programs. And so if you scroll down, you can either click on the tiers to see the individual listings of schools, or you can click here, or to see the full list so you can do a comparison. So if I'm a student and I want to go to school in Georgia, I'm going to look at schools by state because I want to stay close to home so mom can do my laundry. And when I look at schools by state, okay, there's Canada and Arizona, California. Okay, so I could either go to Savannah State or Georgia Tech. Well, let's say I go to Savannah State, although I am going to Georgia Tech, but in January. So Savannah State, there's a concentration or certificate there, but there's no information on their website, right? So you would have to go to their website to find it. Well, let's say I'm discouraged by that, and I'm going to now go to Georgia Tech, and I see, okay, there's information on their program, faculty that have a health interest. Here's actually a course and a course description. And if they had a joint degree program like Florida State does, and Florida State is perhaps one of the leaders in this field, you see again faculty as well as their degree program and a description of their program on their site, which this directly links to. And so I think it's a really good resource, especially for students, but also for faculty as we are beginning to teach in this area. And then one last point on the website, and then I'll wrap up with 1 minute and 33 seconds left, is just a number of web resources. And so a number of your websites are here. So we have Active Living Research, the American Planning Association, Healthy Community Interest Group, the county health rankings, which many of us have found, the food desert locator that's put out by the USDA, health and safety information on household products is another one that I know students have found to be very helpful, especially as we're down at the building at scale. Informed design was mentioned previously. There's also the Center for Design and Health wiki, which I'll go to, that Matt, Tom, and I had some hand in putting together this past summer. And this wiki includes information on, again, physical activity, nutrition or food, and injury. And as you go to any of these links, you can find the citation and abstract, as well as the link to the full article. And you can also search the wiki for information. The wiki will be updated by the Center for Design and Health staff and interns, but the data that's there, the information that's there is up to July 2011 on articles that are from 1995. And last, let me just end by saying that there are, I think, just 3 real kind of take-home messages that I think are important for us to keep in mind. And I'll end on this, but they are, one, there are a number of available resources on course design and training, whether it's my website or a number of other websites. These, I think, should be encouraging to us to help encourage our faculty to begin to teach in this area so we can actually train students to do quality research and to help transform communities to be healthier places. 2, training in this area is really evolving, and that's one piece that I'm working on currently, looking at how syllabi have changed over the last 9 to 10 years. What's being taught now, what's not being taught anymore, why is that changing, how does that match up with the research that's being conducted, and what are the next questions that need to be asked so we're really ahead of the curve. And then 3, as you can see, this the website has lots of information. It requires a lot of kind of my woman power, and if there's a way that it can be automated, I would love to get that kind of guidance from those of you in the room. I don't know that we can put sensors on faculty members to automatically download syllabi, but perhaps there's something else we can do. And so just leaving you with 2 questions. So what's next in this arena for training? What do we need to do? What do we need to include in such a course so that the professionals that come after us can continue the hard work that we've put into this area? And what would be most useful, right? So we could do everything, but where should we actually put our energy? So thank you.